Physicians of Reddit. What's the worst injury you've seen at a routine checkup? Story 1. Guy comes in for an eye exam. I note one eye seems a bit redder than the other. He tells me it's been like that since a branch snapped back and hit him in the face 3 months earlier. I look under his upper lid and there is a piece of the size of a Tic Tac embedded in the underside of the eyelid. Cannot believe it did not bother him more. Story 2. My brother once jumped on the front of my white car, grabbing the front pillars with his hands. I closed the door and caught his finger, which he pulled out quickly, as you do. But there was a tiny chip of paint that had come off the car and got lodged under the skin somehow. He must have spent a week or so chewing on it to try to get the paint out, but it just wasn't working, so he went to the doctor to see if he could help. After checking it out, the doctor tells him, "The reason you can't get that out is because it's your bone." Apparently, when I shut the door on his finger, I'd broken the tip of his pinky enough so he could see the bone through the skin, and he'd spent the next few days trying to pull his own finger bone out with his teeth. Story 3. Not a routine checkup, a woman 36 weeks pregnant comes into the doc in the box, complaining of nausea, vomiting, and pain between her shoulders. We ultrasound her abdomen, everything was fine with the kid. Somebody had the bright idea as long as the ultrasound was out to ultrasound between her shoulders. To our astonishment, she had a huge dissecting aortic aneurysm. She had to be survival flighted to a level 3 place and have a crash C-section and her aneurysm fixed. The aneurysm was at least 5 centimeters across. She and the baby both made it. Story 4. Not a physician but a clueless patient. Went to go see my doctor for a checkup, had chest pains waking up that morning, started to feel like someone is sitting on my chest, walked 15 minutes to the physician's place, and apparently after he checked my breathing, he told me I had to go to the ER to get my lungs x-rayed. Spent a week in the hospital for having a 40% collapsed lung. Doctors called it a spontaneous lung collapse. Really not the kind of spontaneity I'm looking for in my life. Edit. A lot of people are asking if I'm tall and skinny. I was pretty fit at the time, was running half marathons, and I would say average height, 5'11". Also, never smoked anything ever. Story 5. First-year nursing student in LA, and I was at clinicals when a guy who I had to do a physical assessment on, all we could do since we don't know much, tells me he's been hearing strange cracklings and noises in his ear. I check his ear, and it is filled with so much wax and whatnot. Call my RN advisor and she proceeds to clean out the guy's ear. What does she find? Fucking fruit fly nest. Yeah, the medical field can get pretty rad. Edit. Sorry for making so many of you cringe at the thought of that happening. I'm sure it's not as common as some people mentioned. And by nest, I meant 3 or 4 of those things. Story 6. Not a physician, but I was doing medical service in Guatemala, and we had an older gentleman come into our clinic to have a checkup, and the entire time he sat there with us, he was resting his arm on what we thought was a bag or purse on top of his leg. At one point, he goes to move, and we see a huge lump underneath his poncho, what we thought was his bag, and ask him about it. Turns out it was a tumor that had been growing for around 10 years on his leg, and he wasn't even going to tell us about it. Story 7. Junior doctor from Australia here. I had a young lady come in for a pap smear. She was chatty and relaxed, not nervous at all. She lay on the bed and I got the speculum ready. I opened it up and instead of seeing her cervix, I saw a kiwi fruit-sized blob of tissue just hanging out in her vaginal canal. It was one of my first pap smears I ever did, and I had a sudden bizarre thought that I had broken her vagina. I hadn't though. It was just a big uterine polyp that had emerged and was in her vagina, hanging by a thread of tissue. She was mortified, although I tried to reassure her. This was in a small town, and later that day I went to the bakery to get some lunch and she was behind the counter. The most common surprise I see is patients in long-term marriages, etc., who come up positive for chlamydia. Edit. Wow, thanks for the replies. My first post. I'm a long-time Reddit lurker but never joined. Story 8. Mine's nothing on the few things that are here, but I can share something I found myself. I'm an ophthalmic technician. Basically, my job is to do the diagnostic scans and workups on patients before the eye surgeon sees them for routine consultations. One lady came in, referred from her optometrist for cataract surgery. The optometrist did note she had slightly higher than normal pressure in one eye at 23, normal ranging typically between 10 and 20. When I checked her pressure, it had risen to 35. Normally, straight after this, I would dilate her eyes so the doctor can see inside. But I told the lady that based on a hunch I wanted to do a scan of the angles between her iris and cornea before doing that. I found that these angles had closed. Basically, due to her growing cataract, her iris had pushed out, blocking the gap at the outer edge of her iris where the fluid in the eye generally flows. Because of this, the fluid in her eye was very quickly rising. Acute angle closure. Glaucoma isn't rare, but if you dilate someone's eye who has it, you close those angles even more, and eye pressure continues to rise rapidly, causing death of nerves in the eye. I'm just the tech, but thanks to my hunch and scanning first, I could have saved her sight. The doctor performed laser treatment that day to hold those angles open until her cataracts can be removed. Story 9. ED Doc. So, hardly a routine visit, but a guy comes up to the triage window with his arms over his head, palms of his hands pressed against his ears. "Hey, I'm in tremendous pain," he says, when asked what's wrong. X-rayed him and found he'd broken his neck. He'd been walking around with it for 3 days. Story 10. Nurse, but some guy came in with Lefort 2 and the 3 fractures. Said he fell and hit his head on a tractor step about a week ago. Was just coming for medication refills when we asked about the mild facial trauma. Tiny laceration, unremarkable bruising. Denied all pain medication and very minimally accepted it after surgery only because we practically talked him into it. Maxillofacial surgeon was excited about it. She came down personally to get him and take him up to surgery. Edit. TLDR. His face was floating and not attached to the rest of his skull. Story 11. Not physician but X-ray tech. Had a patient walk into the urgent care for hip X-rays. Her order said it was for hip pain, which is pretty routine. Turns out she had walked in on not 1 but 2 fractured hips. Story 12. I went to an urgent care and someone must have miscommunicated to the doc because I rolled into a room in a wheelchair and doc asked me about my cold. I said I don't have a cold, but I'm not sure what I did to my leg and rolled up my pants. My kneecap was on the side of my leg. They seemed rather surprised. They told me to go to the ER immediately. Story 13. Not me, but a friend of mine worked in the ICU, and he once told me about a girl who came in that was on a jet ski and her bikini bottoms got caught on something and ripped her entire bottom open. Vagina to butthole completely ripped open. He said that stitching her up was incredibly awkward because she was a little drugged and super flirty. Story 14. Another, not a doctor, but. I arrested a guy after a brief foot pursuit for attempted burglary and several other nuisance charges. He was covered in blood from multiple small scratches when I first found him and had a decent-sized gash above his eye that looked like it just needed a couple stitches. Took him to the ER to get stitched up and they did a CT scan. Doctor is stitching the guy up and about to release him when the CT comes back. Fractured orbital resulting in an air pocket forming in the guy's brain cavity. Turns out the guy dove headfirst off a rooftop earlier in the night and hit a fence on his way down. Meth makes things exciting. Story 15. We just got a guy in with Fournier's gangrene from a very alarmed family practice doc. His nuts are in his thigh now. D-edit. Gangrenous and taint, if you were curious. Google Images has some exciting results. Story 16. I'm the moron patient. I had fallen through a ceiling 3 years prior and had just worn a knee brace. My employer required me to go to the company doc for a yearly physical. I'm not a doc, so I can't gauge, but here's the list that came out of that visit. Torn meniscus, ACL, rheumatoid arthritis, Hashimoto's disease, and the place I went had in-house genetic testing, and the doc suggested that I should get tested, since I had Hashimoto's and rheumatoid, to help determine what else I had. It was out of pocket, but I thought, why not? I'm sure it was one of those upsell sort of deals, but it really paid off in my case. Test found all kinds of crazy that I carried but don't have as of now, most of it autoimmune related, but found Thompson's disease, which is what those fainting goats have that cause them to faint. In reality, my understanding is that they don't faint. Their muscles involuntarily lock up, and they just physically can't get up. I have a mild case of it that only affects my arms, but it's estimated that like 1 in a million have the mutation. I have to wear a brace on my arms from time to time if I have to make a very quick movement. I'd had a lot of unexplained muscle soreness that suddenly made sense. Another weird side effect I have is that I have trouble swallowing food from time to time, and if I go all day without eating, it's almost impossible to hold my eyes open by the evening, and it has nothing to do whether I'm sleepy or not. He is my primary care now. Amazingly thorough. Edit. I'm passing out. Catch you guys later. Cheers. Story 17. Mum's a nurse and told me about the time a bodybuilder came in with a pulled muscle somewhere in his abdomen that was causing him severe pain. Long story short, the guy was riddled with cancer. It was everywhere. Apparently, he was dead within 72 hours. Story 18. I was putting a patient with mild breathing difficulty on a COPD research study. He remarked that he had been healthy as a horse all his life. The next day, his routine chest X-ray showed metastatic lung cancer. He was dead within 2 months. Story 19. This was not a routine medical exam, but I was a triage nurse in the ER when a patient calmly walked up and reported a complaint of pain in my side. He failed to mention the blood and the handle of the butcher knife sticking out of the left lower quadrant of his abdomen. He was a homeless schizophrenic who had been stabbed and had calmly walked into the ER and waited his turn to be seen. I am just glad he came in at all. We also get a lot of people who come in for other things, a sore throat or a cough, and when doing a skin assessing we find huge pressure ulcers or gangrenous feet. I have twice had a patient's toe come off when I removed their sock. Neither time had they come to the ER for that issue. Story 20. Not a physician, but my doctor might qualify. Got a fever for a few days, had no other symptoms. I know that a fever without other symptoms can be really bad, so I go to the doctor. He says it's probably the flu and sends me home. Fever gets a little worse. I call him and tell him it's up to 102, and he tells me to go to the hospital. I get there. They give me drugs to reduce the fever and do some blood work while keeping me in quarantine. Got my own room, which is nice, because they didn't know what I had. Blood work comes back, and I'm septic. They said that it came from too much oral bacteria getting into my bloodstream, and that they usually see it with druggies that lick their arm before sticking a needle in, thinking somehow that it's sanitary. I traced it back to a mechanical toothbrush I got and how it made my gums bleed like crazy when I first started using it. So, yeah, go easy on your teeth if you have sensitive gums. The bacteria in your own mouth can kill you if they bleed too much. Story 21. Healthcare professional in an ER, not a physician. Routine. Older woman came in for bruising. She claimed that 2 weeks prior, someone had bumped into her on public transit, and now the bruise on her chest wouldn't go away. Confused after having asked her height and weight, 90 lobios, I asked if she had lost any weight recently. Apparently, she has lost about 40 dollars in the last 2 months. The bruise? Malignant fucking melanoma. Oh yeah, with Mets. Edit 2, metastasis, everywhere. She was given a prognosis of 3 weeks to live. If I recall correctly, she passed in 2. Other injuries that rank high on the worst list. Every pediatric code ever, GSWs, edit, gunshot wounds, to the HC or face sock who are still conscious, patients who die with readily apparent defensive wounds, any injury that results in decorticate or decerebrate posturing, suicides who use razor blades to etch suicide notes into their own skin, and ripping both of one's eyeballs out of their sockets with one's own hands. Story 22. Guy shows up for a discharge physical, Marine. Noticed what looked like cellulitis on his leg? Turns out it was a brown recluse bite that he ignored. Had a fist-sized hole of dead tissue in his leg. We treated it with maggots for a few days. It healed over with a very nasty dent scar. Edit. Yes, maggots are still a thing. We import them from Mexico. We dump them straight into the wound and put a clear cover over it so we can see them. We check a few times a day to make sure there aren't too many dead ones in the wound. They will eat only the dead tissue, and yes, the patient can feel them squirm. We also use leeches. They are good for the anticoagulant effect for things like finger reattachments. They keep the blood flowing and keep swelling down so the blood vessels can reattach and heal. We use cats in nursing homes to keep the residents in better spirits. Even the worst Alzheimer's patient seems to respond to cats. We also use electric eels to help keep babies awake so they... Okay, that's not true, but it is funny. Story 23. This is probably going to be buried, but oh well. It was a nurse back in South Africa who made the discovery. When I was 6 or 7, I started feeling very ill. You know, fever, nausea, the standard symptoms of everything. Went to my family GP, saw me, and didn't even do a physical examination. Declared that I just had a particularly bad case of the flu. Fast forward to 2 days later, I wake up in my bed laying on my back, screaming for my mum, and in fear, because I can't fucking move. Total limb paralysis. Mum, being the good parent she is, made the call to take me to the ER. She mentions that our GP said it was the flu, and it might have been a bad symptom. Nurse, bless this woman, does a physical, finds a tick tucked under my armpit. Turns out I had tick paralysis and it was pretty far advanced. According to the attending, via my mum, if it had been a day, or even 5 hours considering what sort of mood she's in when she tells the story, later, I'd be dead because it would have shut down my respiratory system. Not as insane as some of them here. Read the ones about nutsacs being torn open, gangrene, et al. But God, I'm thankful for nurses even to this day. Edit. I wasn't a nurse, just for clarification. My typing style is just horrible. Also, Jesus, my highest rated comment so far is about me nearly dying. Cool. Story 24. Not me and not a routine checkup, but my uncle is a severe hypochondriac, and it almost always leads to complete hilarity. This is my favorite story of his nonsense. He, along with my aunt and cousins, had a big family trip planned about 5 years ago. Don't remember where to, but far enough that they had plane tickets booked. Fast forward to the day before the trip. My uncle says he can't go. He says he's been seeing this weird object in the corner of his right eye for a couple days, especially any time he turned his head to the right. Naturally, to him, that means he's dying, and he doesn't want to die on their trip and make his family deal with flying his body back home to bury him. So, the entire family ends up staying home and canceling their vacation plans. My uncle goes to the doctor 2 days later, convinced he was days away from death. He tells the doctor about this weird object he keeps seeing out of the corner of his eye, but can never really focus on. Doctor initially thinks it might be an eye issue. Uncle is convinced it's a fast-spreading terminal brain tumor that is, somehow, foretelling his imminent death. Doctor takes a closer look, only to find that the object my uncle kept seeing in the corner of his eye is nothing more than an enormous gray ear hair coming out of his right ear, literally like a 6-ear hair, that often happened to find its way into his line of sight, most specifically when he would turn his head to the right. Till DR. My uncle thought an abnormally long ear hair was a sure sign of his imminent death. Story 25. Heard this story from my aunt who works in an eye center. One day this woman came in with her friends, all drunk and high as. She was holding her eyeball. Somehow she managed to get hit in the face by a pair of heels, and it pulled out her eyeball in the process. The kicker is after surgery and all that, she still seemed cheerful and even asked my aunt when her eyesight would recover. Apparently, she was under the impression that her eyeball could be reattached. Story 26. I was working at Target, lived half a mile away, so I walked to work. It totally sucked, but I was out of shape and have cold-induced asthma, so I ignored it. At this time, I was picking up shifts left and right, so sometimes I was closing the coffee shop, sometimes coming in at 4 a.m. to unload the truck. I was basically a zombie from what I assume was lack of sleep. This goes on for a couple months, until I had my annual physical. I was joking with my doctor that I was super exhausted from work, and I must be getting out of shape because that half-mile walk to work really sucks. Turns out I had severe pneumonia. One lung was totally full of liquid, and the other had some liquid too. The doctor couldn't believe I was still up and about, let alone walking to work and whatnot. Story 27. A patient who had a routine checkup at his ophthalmologist, eye doctor, who found a small spot in his retina, was referred to a university hospital. Tests showed it was metastases from a small malignant melanoma he had on his back. Our professor canceled our lecture because he had to tell this otherwise healthy man that he probably only had a couple of months left to live. Story 28. Not routine checkup, but saw a few things in my days. Guy from Mexico had worms in his brain. A 14-year-old girl's head became separated by her spine. Basically, atlas and axis separated, and only vessels and nerves kept her head on. Saw a girl paralyzed from acupuncture, lost all use of her legs. Saw a guy destroy his dong by ripping out his calf. Countless amounts of people die, one from a biopsy right in front of her son. Carried a lady completely ripped to shreds by a car, she was dead. Saw a 18-year-old boy with a shaving cream bottle up his butt. List goes on. I moved into cancer treatment after that and seen many sad ones. Seen a health young guy with his whole face, neck, and mouth removed. Never smoked. Another kid in his prime with stage 4 testicular cancer. For some reason, these stood out to me. Count your blessings if you're healthy people. Story 29. Med student here. Was shadowing in the ED when a bloke came in who fucked up a huge jump on his mountain bike without his helmet on properly. He was going fast, landed on his chin and slid along the hard dirt. Inside his mouth, he had completely detached his lower gum from his jaw, and his mandible was clearly visible as soon as he opened his mouth. There was a lot of blood and a lot of stitching to do. Story 30. Not me, but my aunt, who is a nurse. She worked at a walk-in type of clinic, lots of low-income help and things like that. Had a guy walk in who had been stabbed in the stomach. Like a deep plunge through the soft part of his belly and sliced on its way out. Apparently, his hand on his gut was literally holding his intestines in. He got to an ER real soon. Story 31. As a radiologist, we see things that have been swallowed by kids all the time. I've seen a fish hook, marbles, open padlock, 5 cm steel nail, batteries of all shapes and sizes, open safety pin, and countless coins to list a few. So long as they get past the stomach, they usually pass through pretty well, except the fish hook. But the ones which have caused the most damage are buckyball-style magnets, which can attract to each other through the bowel wall, causing perforation and leakage, or button batteries, which rapidly discharge and burn through tissues. There have been deaths from these seemingly harmless little things. Story 32. Not a doctor or physician, but I work in a cancer research lab. This happened when I was doing a summer internship in a lab that was studying circulating tumor cells. Some background about circulating tumor cells. Tumors can spread from one organ to another. One school of thought in the scientific community is that cancer cells from the original tumor somehow dislodges itself and travels in the bloodstream until it reaches another site that is suitable for it to plant itself and set up another tumor growth. These cancer cells floating in the bloodstream are called circulating tumor cells, CTC. The application of this theory is that if you can detect CTCs in a cancer patient's blood, you can then classify the type of tumor based on the CTC and then determine what is the best treatment or drug for this patient, without having the need to undergo risky surgery until necessary. So this lab that I was interning at, they work on actual patient samples in a collaboration with the local university hospital. Cancer patients volunteer a vial of their blood, and we try to extract the CTCs and do our experiments on them. As a control, we compare them with normal healthy people who have donated their blood for research as well. We don't expect to be able to extract CTCs from our normal samples, but once in a while there comes a sad day where we actually do get CTCs from our normal sample. This means that the person who donated blood probably has cancer and he doesn't know about it. What makes it even worse is that due to confidentiality laws, we are not allowed to try to contact the donor to tell him or her to go for a checkup. We can only hope and pray for the person who donated a vial of blood for science that he would be able to seek treatment as soon as possible. Edit. Guys, a few things I wish to clarify. 1. To tell this story, I might have jumped the gun here, that picking out CTCs meant cancer. In reality, this was a couple of years back, and the knowledge pool of CTCs then was not as extensive as it is now. Back then, the characterization of these candidate cells as CTCs were preliminary at best. The focus of this particular study was more on the novel technique of extracting these CTCs, rather than to do an in-depth study on the CTCs. That was up to our collaborators. The method of extraction we used picked up many things from the blood that could give rise to false positives. In fact, the identification method itself had a lot of room for error as well, since this was working on single-cell work in its infancy. What I'm trying to say is, while we could extract out these possible CTCs from normal human samples, it is just a likely possibility that this individual has an undiagnosed cancer. We were not in the position to call that diagnosis as we are, after all just a research lab and not a diagnosis one. Put together these reasons and I'm not surprised if my supervisors did not sound the alarm to the volunteers immediately. Imagine it being an error on our end, but instead of helping the volunteer with a free diagnosis, we have provided him with a misdiagnosis instead. That would be a bigger lawsuit on our hands. 2. Besides, I was an intern back then and was only there for a couple of months. Whether or not they eventually told the normal volunteers, I probably would not know. Story 33. We had a guy walk into the ER, I am in UK, so actually called A&E, with a screwdriver buried up to its handle just to the left of his sternum, about an inch above the bottom edge of the ribs. Some bright spark pulled it out. He stopped walking then. Story 34. My grandmother. She's allergic to the spice and peppers. So, She goes to a church event and eats something that has capsaicin in it without knowing. Almost instantly, her face swells. She just chills like that for a whole day before my mom finds out and tells her to go for a checkup. We just expected them to give her a really strong antihistamine, and we go about our way. No, 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 no. She had to be rushed to the hospital because all of her insides were swelling and her organs were getting close to failing. She had one completely collapsed lung and a partially collapsed lung, which was causing more issues because there wasn't enough oxygen in her blood. It was wild. But she's still here. Story 35. One of my faves, long thought to be an urban legend, but was verified and written about in a medical journal, the story of the conveyor belt masturbator. Story 36. Not a physician, but when I was an undergrad, I was volunteering at the local hospital in the radiology department, CT. One of the CT techs asked me if I wanted to go to the trauma bay with him for an incoming patient. I happily obliged. What I wasn't expecting was one of the goriest scenes I'd ever witnessed. I had heard it was motorcycle accident, so I was expecting a bit of road rash at best, to be honest. One of the EMTs rolled the guy into the bay, and I couldn't get a very good look at what was going on because it was a bit crowded in the room. Some people cleared out, and I scanned the guy from head to toe. I stopped at his knee. It had looked like an explosive was planted in his knee and exploded. There was flesh dangling from where his knee was, and his femur and tibia were clearly visible. From where I was standing, the injury had to have been at least 8 inches wide in diameter. Story 37. A guy comes into work with half of his face just sort of sagging. They were working 6 days a week, 10-hour days at this point, so he just thought he was tired. He went to the doc, turns out he had a massive stroke and was dead within the week. Story 38. Mate's dad was a doctor in the Northern Territory Aus, working at a few Aboriginal missions. A lady came to him asking for Panadol because she had a headache. She hadn't noticed that when she fell over a few days prior, she had scalped herself. Maggoty head skin flap and all. Story 39. Not a physician but did EMT work while deployed for local nationals seeking help. Had one guy get carried in from the nearby village and we're called out to the ECP to see what we can do. For a toothache. He's barely responding when we arrive and smells worse than death. Still makes me gag thinking about it. Start doing the usual initial contact assessment and he's in bad shape. Vitals are all low, he's hardy there, and keeps oozing from his eyes and other orifices whenever you touch or apply any pressure to his face, which feels like an old soggy banana. Come to find out he's had an infection for like 10 years, and it's spread throughout his skull, neck, and into his chest. A single tooth. Long story short, he died not too long after that while we were waiting for transport. The dude went down because he didn't take care of an infection. Never seen anything like that and doubt I will anything. Story 40. Pre-registration optometrist here. Had a lady present recently for an eye test following months of very painful headaches. She had scans done at the hospital recently and everything had come back normal. The only reason she was in for a test was that her eyes were the last thing she could think were causing it, and she was due for a checkup anyway. Cue me looking into her eyes and finding her optic nerves in both eyes, which usually lie flat against the back of the eye, swollen and pressing forward, with massive hemorrhages in the nerve fiber layer of her retina. Naturally, the hospital was phoned, and she was seen within the hour. The swelling had been caused by raised pressure in her head, a potentially life-threatening condition. As far as I am aware, the neurologists are now on top of it, and she is recovering well. Scary stuff as I had only been qualified 2 months at the time. Edit. Put the word pressure in twice in a row. Story 41. Not a routine checkup, but a resident on plastic surgery years ago, University of Michigan, received a lot of patients from rural locations. Was called to the ER to examine a patient with a severe head wound. At the doorway of the dimly lit exam room, I saw a fella in the corner with a white bandage wrapped around his head sitting peacefully. As I unwrapped the dressing, I recall a fetid odor reminiscent of rancid meat. Turned on my surgical lamp and saw hundreds of maggots feasting on rotting flesh, right down to the cranium. Fast forward, took him to the OR to debride the wound. We use this gun-like device that sends a jet of water at ultrasonic speed, very effective for removing the dead matter. My attending finished the job, but not before sending a small bit of debris, which managed to slip behind my protective eyewear, straight into my eye. I screamed like a... Story 42. I worked as a doctor in rural South India many years ago. I was visiting a friend in the village when his dad walked out of his house. Something told me that, While this man had no complaints or attributed all symptoms to old age, he did not look good. I felt his left supraclavicular fossa, area above the clavicle at the root of the neck, and promptly felt a hard swelling. I advised my friend that his dad needed a checkup. In less than 6 months, the old man was dead from gastric cancer. The hard nodule in left supraclavicular fossa was a lymph node to which the cancer had spread, is known as the sentinel node, the lymph node that points to a cancer in the stomach. During routine checkup, once examined a young lorry driver, 40-year-old, with vague abdominal complaints. On examining him, his liver was enlarged and felt lumpy around the edges. Performed an ultrasound scan on him and found extensive metastases all through his liver. He developed jaundice and died in a couple of months. These findings were not really expected and stand out in my memory after 15 years. Story 43. Not quite a regular visit and I'm the patient, but I went to a jaw specialist as a teen after braces messed up my jaw. I was in so much pain that I was unable to eat and lost something like 15 pounds before I could get to this guy. He does some x-rays and comes into the room with this face of ultimate shock. Every time I open my mouth, it opens to the point of dislocation. The only thing he can think of doing to cure it would be wiring my mouth shut, but he wanted to try some other things first. So I go for weekly visits. After about a month, he suddenly asks me if I can move certain joints really far. Ends up taking pictures of my bending all of my joints, and I'm apparently featured in a medical journal. I have Ehlers-Danlos, and my jaw specialist found it. Because of that, I had to go through an intense checkup. There, they found an irregular heart rhythm that had the possibility of killing me. My teeth aren't straight, but I'm still alive, so I'll take it. Story 44. Had a young female come into the ED with a non-urgent complaint of, "I think I'm pregnant." Within 20 minutes of arrival, she is heard screaming in her stretcher and delivers a blue premature baby 27 WKs in the adult ED. We ran the baby to the NICU and luckily were able to save it. Story 45. My dad is a mechanic. He was working on an engine when one of the parts fell off and landed on his hand. He was focused on the engine not falling off the chain. When he looked down, noticed a pool of blood, cleaned it off, put super glue on it, went to his manager and said, "Yeah, I think I need to go to urgent care." Doctors told him he cut almost 90% of his tendon. Story 46. Older patient mentioned that the back of her leg was a little sore. The iron gate to the patient's property was banged into their leg, with the corner hitting them in the back of the leg. They figured it was just a bruise, but due to its location, their age, they couldn't really examine it. Turns out the gate had penetrated the skin slightly, and the patient had about a 1 area of necrotic, totally dead tissue. They had to go have a surgeon cut out around a golf ball-sized piece of tissue from the back of their leg and go into the ER every day for IV antibiotics, dressing changes for at least a week. If it had gone unnoticed longer, it could have developed into a very serious infection. Story 47. I work as a surg tech in women's surgery. I have 2 stories. 1. Had a patient come up from the ER with what we thought was a pretty simple ectopic pregnancy, when a fertilized egg begins to form in your fallopian tube, incest of the uterus. Doctor decided to do a laparoscopic approach because we thought it was caught in time and her bleeding seemed minimal. After placing our camera inside to look around, we found out that she had 2 ectopic pregnancies in each tube and an appendicitis. 2. Patient came in for a simple laparoscopic tubal ligation. Placing our camera inside, we found out that most of her large intestine had become wrapped around her uterus. Adhesions. The doctor took one look and said, "Fuck no, I am not doing this here." She needed to go to a main OR that would be able to handle the 3 to 5 hours of surgery that she would need done. TLDR1. Ectopic pregnancy turned into 2 ectopic plus an appendicitis. 2. Came in for no more babies. Left with a consult for a longer procedure.